Assalamu alaikum, dear students. Warmly welcome to Hussein Lectures and Rayan Online Tutoring. Our today's topic of discussion is gestational diabetes. Let's say, what is gestational diabetes mellitus? Diabetes that develops during gestation or pregnancy period is called gestational diabetes. So it always happens during pregnancy. A pregnant woman can get this disease. Let's say it's steps. Food produces glucose in bloodstream, so we obtain more carbohydrated food, and it causes diabetes mellitus for gestation. During pregnancy, pancreas secretes insulin, which moves glucose from bloodstream to our body cells for energy. Usually, it happens during normal condition. Pancreas produces insulin to bloodstream, and then this insulin picks glucose molecule to our liver and then to our body muscles. But here this insulin malfunctions and doesn't transport glucose molecules to liver and then to body muscles. During pregnancy, placental hormones weaken the impact of insulin. So in a pregnant woman, placental hormones interfere with insulin and thereby increasing blood sugar levels. So that's why inside the blood of a pregnant woman there is a higher level of blood sugars. In case of gestational diabetes, insufficient insulin is produced, leading to higher blood sugar levels, and this is the major cause when a woman gets pregnant. Insufficient insulin is produced due to upset normal of placental hormones, and there is higher blood sugar rise in bloodstream of a woman. Gestational diabetes is common and affects up to 10% of pregnant women. So it's a more socialized fact in our society. Untreated pregnancy diabetes can affect the health of the baby and mother. Both mother and child can be affected by this disease. With proper management, most women can have safe pregnancies and give birth to healthy babies. If a woman is treated properly and given a lot of cares and cures, then both baby and mother can be saved. Now here is risk and effects of gestational diabetes on the baby. What are the risks? Let's say might result in high birth weight. Now the first risk is that there is higher body weight for the baby, low glucose level inside baby's bodies, and jaundice may happen. Now the last is respiratory distress. Respiratory distress may happen in baby. On the mom, while with mothers, what happens? Might lead to preeclampsia. Now, this is the first condition. Mothers have to face preeclampsia, that is premature birth. Baby have to be released out before their time or delivered before their time, and developing type 2 diabetes after delivery. It's okay. Now here how gestational diabetes affects the mother. Once again, mother effects are discussed here. First, future diabetes in life. Mother may pass through this a serious condition like future diabetes. Higher chance of C-section delivery. In the next, during delivery, mother may face high section C-section delivery and then miscarriage. Now it's a bad news for pregnant women. Due to GDM, she may have miscarriage and preterm birth. So this is the before the time birth of a baby may happen. No, here is a pictorial evidence. High blood glucose level in mother. When there is rise in high blood glucose level in mother bloodstream and deficiency of insulin hormone, that brings extra glucose to baby. So extra amount of blood glucose enters inside baby bloodstream, causes baby to put an extra weight. There is rise in weight of baby. Now here are some symptoms of gestational diabetes. First is polydipsia, that is excessive thirst for mother. Mother may have to face excessive thirst. Second, polyuria, increase in the frequency of urination. Mother may urinate frequently and excessively. And third is xerostomia, that is a dry mouth. Mother may occur through dry mouth, may face a dry mouth condition. Genitalia itching, genitals, the special reproductive parts of the female may face itching. Then blurred vision, she may have to face a double vision. And then general malaise. Now here are some other symptoms of the diabetes, like headache, dizziness, blurry vision, tingling in hands or feet, frequent urination, thirst, hunger. These are the pictorial symptoms as seen in diagrams. Now, diabetes symptoms, this is over the last slide. First is slow healing of wounds, increased thirst, body weight loss, tingling in the hands, hand may tingle properly, blurry vision, extreme fatigue, always hungry, and then urinating often. So this is the definition, basic concept, causes of the gestational diabetes, and we have learned about diabetes, that how it happens, and we have learned about the symptoms. That's why when we learn the symptoms of the diabetes, so we are aware and we know quite well how to save ourselves. Stay blessed.